comfortable. Okay, good. So just relax. Okay, comfortable?
Yeah.
With the advanced class of hair loss, he's moving toward class 6 or 7. The extent of hair loss, the whole front. We're going to focus on front and corner today, but he's going to go all the way back here and going to end up with this area in the back. The hairline has to do with proportions of the face. So we want to make the face as proportional as possible. But the nose to chin should be the same as eyebrow to hairline. In this case, we can go a little bit higher just because of the advanced hair loss. And then I already marked that area, so but the way to do it, lift your head please. That proportional face, you start drawing the line and the corners should be 1 and 1.5 centimeter behind the front. So we have 8 centimeter here on corners, we going up to like 9 centimeter, 9.5, and then we connect the dots very irregularly. So this is a typical Caucasian hairline. Do 2000 grafts. I want to mark the area of maximum density in the very front and divide it into boxes so I know how many grafts I'm putting in each area. And then I go behind it and mark my secondary area. He's going to have a nice and solid hairline and he can comb it back and comb it to the side the way he wants, but he still needs more hair transplant in the back in the future. My anesthesia. We're going to get started soon as he gets a little more relaxed.
I'm just here getting my procedure done and hopefully it'll look good in months to come.
Having a lower than expected number of grafts in donor area. Simple fact that he's going toward class 7, some of the borders of donor area is not quite stable. So we have a limited area to work with. See it?
Yeah.
Okay, there we go.
Oh wow.
Look at how
Okay,
much.
that's my hairline.
That's great.
That's perfect.
Hair is on the side. Do you see that?
Wow, yeah, it'll match and then, okay, perfect. Then it'll help
One
grow.
step at a
it.
time.
He'll try
Yeah.
and hold
One
it.
Do you think that, I mean, possibly like the propecia could take me from class 7 to class 6?
Your case is going to help you to maintain your hair as much as possible. It doesn't change your class, but it can buy you time.
Okay.
The pictures of the patient, there's before pictures, you see although you have some hair on top, but it's also pretty thin, and that shows that we're going toward the advanced class of hair loss. So this area all is going to be gone at some point. So he had a hair transplant, and let's look at his after photos. These pictures right after the procedure. We covered this big area. We went a little bit more back here in case you want to comb from side to side. In case of a advanced class of hair loss in a young gentleman, we give him a higher hairline. That's what we usually do. In fact, the hairlines used to be higher for these cases, and now recently we're becoming more lenient because we know we can use beard hair and body hair, especially for someone like him that he has a good quality beard. Like him in the future, he can have another hair transplant, removing some more from the donor area, but it's going to be very limited, and then we have to end up using some beard hair or body hair. That was another presentation from Parsa Mohebi Hair Restoration. This is Dr. Mohebi, wishing you a happy hair day, and we'll talk to you later.